This is Tracy Genaeu. Tracy's a client that came for some help with a couple of things. Tracy, why don't you talk first about the pain relief that you've received? And you have fibromyalgia, right?
Yes, I do.
Okay, so talk about a little bit about that.
Well, the first day that I came, I had my regular amount of pain, which is like everywhere, but my back was really, really sore. And I remember sitting on the couch and I was just trying to focus on things, but my back hurt so badly. We did a few things, and after the first session, I just remember sitting there and you kept talking to me and then asked me what's going on. I said, my back doesn't hurt. And I was like so surprised the pain was just completely gone. And it hasn't come back since.
And it's been about 6, 7 weeks.
Yeah.
And that pain, it wasn't just there that day, though. It was pretty much.
No, it was to the point where I had to, I had to buy a specific bed to try and, because it was right in the middle of my back, so I had to have something cushion me, or I couldn't sleep at nighttime.
So how long did you suffer with that back pain?
For years.
Years?
Probably, yeah, years and years.
On a scale of 1 to 10, how painful was that back pain?
Probably about an 8 or 9.
In the previous month, for, so let's say a month straight, 8 or 9?
Yeah.
Okay, and what is it at now if you had to describe it as a number?
Non-existent. It's
so
just
zero.
Zero, yeah. It's
Okay.
not there.
All right, and then the other thing was your shoulder.
I have had some problems with my arm and my shoulder that we're looking into, and it was to the point where I couldn't lift my arm up to try and, probably past here, to try and do anything. And then we did some work in I think the last session, and now it's pretty much pain-free. I can sleep with my arm not being sore at nighttime, and I can move my arm up fine. And it's just when I work out that I feel some of the pain, because there is an issue there, but I don't feel it the way I did all the time.
Okay. And you do have fibromyalgia, so it's not as though you're completely pain-free. No. You still deal with pain. Why don't you describe a little bit about how your quality of life has improved because of how you can manage that pain now?
Well, it's been a lot better. Like I used to be really physically active when I was a bit younger, and as the pain progressed, after my second child was born, I couldn't work out as much as I used to or push as hard as I used to. But recently, in the past like 7 weeks, I've been able to work out every day. I'm off. I do workouts that I used to do before I had kids that I couldn't do anymore. And I find that I can push myself a lot more. So I'm getting back to the point where I was before, where I was physically active and healthy and felt good.
All right. I know you mentioned to me that you're stronger and you're doing more weightlifting and so on. So sometimes weight loss isn't really, looking at the scale isn't exactly the best way to tell what's happening to your body. But let's talk about that for a second. How much weight have you lost?
I've lost since actually it was the first thing that I came here for. It wasn't pain relief or anything, but when I first came to you, it was to lose weight because I had given up on being able to get where I wanted to be. And I've lost about 9 pounds now.
Okay. And are you using willpower to refrain from food, or?
No, I don't. I don't feel hungry all the time anymore. Like before, what I've learned is, even from this, is that a lot of the problems that I had with food was from anxiety that I felt in my stomach, because it always grew there and it just felt like I was always hungry. So before I would try and, stop myself from eating, but I couldn't do it, right? But now I don't even feel hungry. When I'm hungry, I eat, and then when I'm not hungry. So it's not like I have to do anything extra to try and stop myself from eating things. I just don't want to.
Yeah, because that emotional state that you were trying to distance yourself from with food, you know how to distance yourself from that emotional state using your mind instead.
Yes, and when I do have cravings, I know how to work through it so that I realize that that's not really a craving, it's just something that my mind's creating. So I work through it, and it takes a couple of seconds and I can get rid of that feeling.
Okay, excellent. What would you say to somebody who's suffering from pain, from chronic pain, maybe joint pain, and they've done everything they can to try to alleviate that? What would you say to people that are suffering from this pain, that have just resigned themselves to the fact that this is just going to be their life now? Because you had done that before we started this work.
Yeah, it was because, given a diagnosis like fibromyalgia, I think it gets into your mind that, I can't do as much, or I can't, be as much as I wanted to be. And that kind of snowballs. So then you end up having, more and more pain and less happiness in life, right? I think that a lot of that pain is probably created from your emotional state, about how you feel about, your diagnosis, or if there is a problem, and you actually make that worse in your mind. So then you feel worse. And I think that if you can do a program like this and learn how to control those emotional feelings, then your pain will dissipate, and you'll have a lot better quality of life.
And let's just be clear, I did tell you right from the very beginning that I'm not a doctor. You have an actual diagnosis. You need to consult with your doctor when it comes to medications. And as far as starting a exercise regimen, you wouldn't really go harder with your exercise simply because you can remove your pain through some mental exercises. You go slow and you listen to your body.
Yeah.
This is a supplementary type of an intervention. It's an adjunct to something that you're already doing with your doctors. It's not a solution, and it's not something to replace, um, you know, the advice that your medical doctor is giving you. I was very clear on that. And
Oh
you
yeah,
understand
100%. And I mean, I didn't expect to have any pain relief because I just knew that the pain had been so bad, and we've tried so many different things. But I'm still doing all of my regular treatments, and my doctors are really happy with the way things are progressing. My pain level is significantly less. It's still part of my life. I still have to work through some days when I have bad days, and but like some of the pains that were constant have gone, so that's made my quality of life a lot better, and I can push myself. That's my goal. I always wanted to push myself harder, and I can push myself back to where I want to be.
that. Okay. All right, perfect. Thanks very much for doing this video.
Yeah, no problem.